This 70-year-old woman had suffered cardiac myxoma, a tumor in the heart, and is recovering from an open heart surgery at the National Cardiothoracic Center Intensive Care Unit. According to the surgeons, she would be put on respiratory support overnight to enable her heart recover very well. They said the shortest time a heart patient has been put on life support at the center was 12 hours, while the longest was 45 days, and for a lung surgery, 65 days. Worrisome is the ICU bills of critically ill patients not covered under the National Health Insurance Scheme, NHIS, and the hospital administrators indicated if the patient is admitted straight to the cardio ICU, a deposit of 4,000 cedis is paid.
ICU costs are very expensive, 1,500 Ghana cedis a day to maintain them on the life support, all the monitors, the drugs and other things. In an ICU with multiple organ damage can destroy the whole mutual health system of one society. As to whether NHIS can cover intensive care unit, it has to be a political and then governmental decision.
And the cost of critically ill cases is a deterrent.
We don't cover them because the cost involved in taking care of one person can't take care of not more than 1,000 people.
Can we ever get there?
Yes, there's oil. We have politicians and people who have goodwill for the country. I think if they were to levy certain aspects of our economic activities and channel it into emergency care, then yes, if that money is kept aside for that, then we can get there.
25th, Saturday, we'll be having a meeting with health insurance, and these are some of the things we'll be talking of.
But how equipped are government health facilities in Ghana with life support machines?
We do have all the regional hospitals with basic life support machines, all the district hospitals with basic life support machines.
Which are functioning?
Which are actually functioning. However, some of them, of course, are old, and I know there is a hospital equipment distribution program going on.
Following up on the first part of my life support story, it was good to know the 17-year-old girl who suffered gunshots in her head had been put off life support and moved to the main ward on January 18.
Are you feeling better now? Has the pain gone down?
Yes. Her parents mentioned she had recovered quickly, but had to pay 3,000 plus cedis instead of the initial 2,000 cedis deposit. Consultant anesthetist at the Surgical Intensive Care Unit, ICU, of the Kolebu Teaching Hospital, Dr. Chris O, said she would be discharged soon. But sadly, before I ended the second part of my story, a lady who was in the same ICU with a 17-year-old who suffered more than 60% burns died on January 17, 2014.
Oh, she was going to die, and if you did, why did you put her on life support then?
No, we did not know that she was going to die. We did not hope that she was going to die. Looking at what percentage of burns or what percentage of injury has been caused gives us an idea how difficult it is to make it. But as long as you still have a window that you can tap into, that is part of our responsibility to use that window, because it's so easy to say that if the person is 60% burns, the chance of the person making it alive is probably 30%. You are so close to people passing away tragically. How do I get to see that I don't feel it? The frank truth is that we do. We still have to muster some courage and some strength to go on those who are still in intensive care units.
Wendy, TV3.